Hello, everybody. It's Laura Ellen Christian with AGE-u-cate Training Institute. It's so great to be back with you. We are going to wait a second and let everybody roll in as we've started the webinar. But we are here to talk about scaling expertise. We're going to dig into how the Alzheimer's Association ECHO project impacts dementia care. And so in a minute, I'll introduce our guests, Dana and Jamie, and how they are going to engage with you in conversation today. But we will just continue to wait just one more minute and make sure everybody that wanted to show up is able to join us. So we see the numbers rolling in. I know we have a hurricane and weather rolling in the Florida area. So we're definitely thinking about everyone in the hurricane's path. I'm in the Atlanta, Georgia area. We are having storms come through. So Dana and Jamie are prepared if I disappear for loss of power or internet interruption during this. But wherever you're joining us from, I hope you're safe and well today. Um, but we'll go ahead and get started. And if other people join us, then that's great. They can join in on the conversation. But again, I'm Laura Ellen Christian with AGE-u-cate Training Institute. We're so excited to be back. We took a little break of our webinar series over the summer, and we're back and we'll be offering a few more webinars to round out the year. So in doing that, we sent out a survey to see what you, people within our network, wanted to learn more about. And connecting in with national programs and initiatives was one of the top rated topics for webinars to round out the year. So we are so grateful and thrilled to have Dana Sommer, the director for Project ECHO for the Alzheimer's Association, joining us to share more about the impact of this program. In her role, she leads the strategic oversight and direction of the ECHO learning platform, connecting dementia care experts with healthcare professionals and professional care providers to increase access to early and accurate diagnosis and to quality dementia care. So it's great to have you with us today, Dana. We also have Jamie Cobb Tinsley, who is the Vice President of Dementia Care and Caregiver Education at James L. West Center for Dementia Care. So welcome, Jamie. She is a certified Alzheimer's educator and Montessori dementia care professional. She's also certified as an independent positive approach to care trainer. She has been working with AGE-u-cate and is certified in Dementia Live and Compassionate Touch. She's also a master trainer for stress busting program for family caregivers. So a wealth of knowledge joining us. Jamie has been, the time that she's been at the West Center, she's developed and implemented a variety of innovative programs, as you can see from all of her titles and accomplishments of the programs that she can bring out to those in the area of James L. West. So welcome, Jamie. Thank you for your time. So together, Dana and Jamie are going to share with you how they've been able to scale expertise and leverage Project ECHO through the Alzheimer's Association and James L. West being an Project ECHO hub. So I'm going to turn it over to these ladies and I'll be learning with you. Thanks, Dana and Jamie.
All right. Well, thanks everyone. Thanks for having us today. Again, and thanks to AGE-u-cate. Thanks, Laura Ellen. My name is Dana Sommer. I am the director of Project ECHO at the Alzheimer's Association. Can everyone see? Jamie, can you see my slides okay? Okay. And I'm just going to make sure I can see all of you as I go through these slides. All right. And as Laura Ellen nicely set up for you, today you're going to hear kind of stories from two ECHO hubs. I'm going to first start and set the stage around Project ECHO and what it is, and talk about the Alzheimer's Association ECHO programming. And then I'll turn it over to Jamie for a little bit to tell her story and the story of James L. West. So we do have some working learning objectives for today. I'll kind of highlight the first one that I'm going to spend some time on for us in the next couple of minutes or so. just to share the Project Echo purpose, structure, and its role in enhancing care for Alzheimer's and all other dementia through community-based education. But before I do, I'm going to set the stage a little bit with some level setting around the Alzheimer's Association. And our work really is about people and science. And that's kind of shown through our brand logo here on the left of the screen. We are a worldwide voluntary health organization dedicated to care, support, and research of Alzheimer's and all other dementia. And our vision is a world without Alzheimer's and all other dementia. We have a lot of resources across the US that are available for you to access, including our 24/7 helpline. This is free around the clock kind of support that folks can tap into across the US to get access to local resources and information for persons living with dementia, caregivers, and families at the community local level, as well as opportunities to access confidential support. We also have plenty of free education and support initiatives at alz.org that can support patient and family education, as well as support and education for professional audiences as well. So check that out. And then finally, a really great resource that I love is our collaboration with AARP, our community resource finder. So this allows you to really, type in exactly what you're looking for at your community level, and find some things that are happening within your area that can support both persons living with dementia, older adults, and of course, families and caregivers as well. And when we think about dementia, we always like to start with some prevalence information to kind of set the stage for today. So more than 55 million people have dementia worldwide, and I will say that about 60% of those people are living in lower and middle income countries. There are 10 million new cases of dementia each year, and it is now the seventh leading cause of death. It is also one of the leading causes of dependence and disability among older people. And we know that it disproportionately affects women both directly through disease prevalence and indirectly, as most caregivers tend to be women. And here in the US, there are 6.7 million individuals living with Alzheimer's disease today, and that number is expected to nearly double by 2060. So when we think about the growth and the impact of this disease over the years, it just will continue to place a burden on all of our systems across the spectrum. On alz.org, I want to just share too, we have a lot of really great data that you can access if you haven't before. Most of this comes in the form of our annual facts and figures report that is produced each year. It is available online. What's really great about this is you can kind of hone in on what's happening within your state. So there's some state-specific facts that you can download around prevalence, caregiving, healthcare, and importantly, workforce, which is where we're going to kind of focus on today through the Project Echo model. So with workforce gaps, we know there's some gaps in numbers across the US. We just know there is not enough specialists to care for the demand today, and of course, that growing demand that we're going to see in the future. 20 states in the US are deemed neurology deserts. So what that means is fewer than 10 neurologists per 10,000 individuals. And at least 12 states are going to have to increase the number of geriatricians by at least fivefold to, again, meet that growing demand of individuals who will need their ongoing care and support. Primary care providers share that there are just simply not enough dementia care specialists. And so when we think about not just sort of gaps in numbers, what about gaps in knowledge and confidence and preparedness of the workforce? 40% of primary care providers feel not comfortable making a diagnosis of Alzheimer's or another dementia. And 50% of primary care providers do not feel adequately prepared to care when there is a diagnosis made. Those gaps in numbers came from survey data that the association conducted with healthcare professionals just a few years ago. Within the direct care workforce, which I know Jamie and I will both kind of touch on today in our work, there are double-digit increases needed to kind of meet the demands just by 2030 alone. And this stat sort of was staggering to me that more than any other single occupation in the workforce, we will need more than 1 million additional direct care workers between in the next 10 years, really to meet the growing demand of folks that are going to need this care. And I present these two case studies because I think they sort of paint a picture of where we are here in the United States in terms of the need and the challenges to seeking access or seeking and accessing specialty care. These come from two actual learners within an ECHO program at the Alzheimer's Association, so they were really unique in their case. So let's take Steele, North Dakota, which has a population of 660. This was a primarily farming and ranch community. There is a primary care clinic in town, staffed by a nurse practitioner and a registered nurse. And when we met with them and learned their story, they really struggled with finding access to specialists for their patients. The closest neurologist was 45 minutes away and long wait times. And I think neuropsychology was over state lines. And so they really talked about the struggles of those geographic barriers in seeking specialty care, but also some of those cultural and certainly socioeconomic barriers that were preventing their patients and their families from reaching the care that they need. Across the US on the East Coast, the Bronx has, 1.4 million people. We worked with a federally qualified health center, and they served a really diverse and underinsured population, a large non-English speaking population as well. There are lots of health systems across the regions and a lot of specialists, but they often talked about sort of accessing those specialists was still really challenging, both in terms of the referral patterns and the wait times. But they also talked a lot about cultural barriers to care and what their communities really needed in terms of that cultural appropriate care. So we're left with this balance, right? Of we can create more specialists, and there's been lots of efforts across the U.S. to encourage recruitment into the geriatrics workforce or into specialties that serve older adults. But those have remained, not necessarily picked up in the way that we've wanted, and the retention has still not been where we've needed as well. So we can create more specialists, right? And then convince them to move across the U.S. Or we can think about methods to help and support and empower the existing workforce. What I always sort of stress here is that local clinicians and local providers within communities are the resource of those communities, right? They know their families. They've been serving these communities possibly for generations of families. And they understand sort of what is appropriate and what is culturally competent care for those folks. So can we create services and support to empower that existing workforce, which in turn would better support and promote access to care for their patients and families? So Project ECHO began in 2003. This is a model that was meant to help bridge some of those gaps to seeking specialty care. It is interactive virtual sessions, so hosted over Zoom or another virtual learning platform that combine case-based learning with expert presentations. And so that model, that melding of the two is really where the magic kind of happens. Of course, the goals around Project ECHO are really to build workforce capacity to manage care in local communities. So kind of cutting back that need to access and seek specialty care. Some of the themes around Project ECHO are about, getting people the right care at the right time in the right place. And of course, this community aspect of Project ECHO, which is all teach, all learn, where everyone has something to share and everyone has something to gain from participating. And I will say, just in terms of the scalability, and you'll hear this from Jamie and I today, the model is really adaptable. And it's worldwide. So at this point, there are programs across the globe in numerous conditions. But we really believe that all teach, all learn is the infrastructure for bridging those gaps. The idea of this is, let's move knowledge, let's disseminate knowledge into communities and not have to move people around through the complex medical systems in which they operate. So at the Alzheimer's Association, we launched the Alzheimer's and Dementia Care ECHO program in 2018. I'm going to kind of cover 3 of our programs today in just a brief overview so you can get a taste of how ECHO can be applied. Our primary care program launched in 2018. The goal of this really was how to support and empower primary care clinicians and teams to increase that access to early and accurate diagnosis and quality dementia care management in the primary care setting. We invite primary care teams from across the U.S. to join those programs with us, and these are cohort based. So we ask teams to join, and they join us for about 12 sessions every other week for 1 hour meetings. And the folks here on the right side of the screen are our faculty team. So we were really intentional around creating that multidisciplinary learning environment where multiple perspectives and multiple expertise could kind of come together to find solutions to common challenges. In terms of our program impact, this is just the article on the left is you can find it online. It's one of our most recent publications around the impact of our program, but we've really shown some significant increases in building confidence among our primary care participants in a host of areas. So diagnosing dementia, providing advice and appropriate medical care and follow-up after a diagnosis. And I think this one is particularly important is sort of less frustration. And so when we think about the complexities of the medical system and all the burdens that are on our clinicians and our healthcare teams who are managing care, programs that can support and empower rather than sort of add additional burden, I think are super important as we consider workforce shortages and workforce empowerment. This was a second article that came out just earlier this year, so I wanted to highlight it again just on the impact of our ECHO program. And this kind of presents a little bit of a different aspect of where the impact was, but just around participants really enjoying the supportive and valued the learning environment that Project ECHO gave to them, but also sort of that empowerment that they expressed through the participation. And they really did talk about they really felt like this was a place that they wanted to continue engage with. So ECHO not only, showing that ability to help improve knowledge, skills, and confidence, but also sort of bringing people together in this community where you feel like you're not alone, right? You're enjoying the company of others who are expressing or experiencing similar challenges, and you're working together to find solutions. Our professional care provider also launched in 2018. This is really about how do we provide and encourage and enhance the quality of care in the long-term and community-based care settings. The content for this is based on the Alzheimer's Association Dementia Care Practice recommendations. So these are evidence-based recommendations for delivering high-quality, person-centered dementia care. And these are typically long-term and community-based care provider teams from primarily assisted living and nursing homes today. And of course, with our programs, we like to take that national reach. This is a little bit different. These are weekly sessions held over 6 weeks, and you can see our faculty partner here. So again, just sort of showing here that there's a multitude of ways to kind of think about designing ECHO programs, and you can do that with sort of what works best for you. This program has also been super impactful in moving the needle on knowledge and confidence for those professional care providers, and we've been really happy to see those increases over time. And then lastly, just to kind of quickly cover our newest program that we launched just earlier this year was our sort of first foray into working with public health professionals. So we targeted health departments for this and really tried to encourage and expand their capacity to better understand and promote dementia risk reduction. So how do we incorporate risk reduction and sort of prevention strategies in local communities through the messaging? So the content really talked about health equity, social determinants of health. How do you convene appropriate kind of stakeholders in communities? And this is similar to our long-term care ECHO, where we hosted 6 1-hour sessions over the course of 6 weeks. So with that, Jamie, I'm going to turn it over to you where you'll be able to host or talk about your program and its impact, and I'll drive slides. So just you let me know when I should go to next.
I will. Thanks, Dana. And thanks for setting us up with what ECHO is and what it can be. So I'm going to share our story of our ECHO hub here at the James L. West Center for Dementia Care. If you'll go to the next slide, just to give you a base of what the James L. West Center is we are a faith-inspired, not-for-profit organization serving persons impacted by dementia. We are physically located in Fort Worth, Texas, and that's where the majority of our services lie, but we do have a wider footprint across the nation. I would even say across the world through our education and resources because we have such great partnerships and take advantage of these national initiatives like ECHO, but being able to work alongside with the Alzheimer's Association, AGE-u-cate, our local universities here, et cetera. But if you'll go to the next slide. So we have the Janesville West Center is a skilled nursing community at its core. So for 31 years, we've been providing nursing care to persons impacted by dementia. Our building here in Fort Worth, Texas, we can house 112 persons to live here long term. They do have to have a diagnosis of dementia. So we've been doing this care for quite some time, and we are innovative in the care we provide. We call ourselves the experts, but we're continuously learning, of course, all the time. We can provide respite care. We do also do short-term rehabilitation, so it's dementia specific. So we can rehab, somebody with dementia that broke their hip. They can come here for their therapy, and then, of course, go back to where they reside in the community afterwards. We also have a senior adult day program here in Fort Worth as well. And of course, our caregiver programs. And this is where our reach gets a little bit wider. And our gift back to the community is part of our free education to whomever may need it. So we started our education was to really help educate caregivers because they're calling and asking these questions. How do I take care of my loved one? I don't want to go to a long-term care community or I can't afford it, but I need help. So we started this education and we're doing it for 8 years or something like that locally and learned of the ECHO program. So if you'll go to the next slide, this is my attempt at a timeline, so bear with me as we walk through this. But in 2019, after we learned of the ECHO program, we went to get trained to be a hub. So we're able to host ECHO programs here through the Janesville West Center. 2019, we were trained with our main audience to begin with would be family caregivers and those that work with the family. So a case manager or social worker, how do we best educate those families to continue to provide the best care they can for their loved ones? Well, in 2020, March 2020 happened, right? So that kind of changed everything for us. And being a nursing home, that really changed a lot of what we were doing and providing, or changed how we were doing and providing the care for persons impacted. But we were able to partner with our university here. It's the University of North Texas Health Science Center. And we already had a relationship with them. But there was also this nursing home COVID Action Network ECHO that came down. And this was in tandem with, who was it? It was the NIH did it, was part of it. The Agency for Healthcare and Quality Research and ECHO. So those national organizations teamed together to do this COVID Action Network ECHO. We partnered with UNT Health Science Center to be a hub of one of those ECHOs. It was, I think, a 16-week series they did right in the middle of ECHO to help nursing homes really understand COVID and what's going on and how these things are changing, but also, like Dana mentioned, just have a community to talk to each other and be able to hear from each other and hear the case studies and how are we all managing this? Not just boots on the ground caring for our residents, but how are we caring for ourselves too? Which is a wonderful outcome of the ECHO programs. But it also gave us the ability to actually really understand ECHO, all the logistics, how to run it behind the scenes. Because when we are a hub of ECHO, when I say we're a hub, yes, we're a hub, but there are really one and a half of us that run the ECHO program. But this is just part of what we do. So we also have all of our rest of our responsibilities to do as well. So I know this was a program that we just folded into all the other programs that we were offering. So, we got through the COVID Action Network and we continued to see the benefit and the need of long-term care nursing communities to stay together as we are starting to in 2021 and 2022 come out of the midst of COVID, but we're still in it. And how do we get back to this new normal, right? And how we provide this care. So we continued to pilot with UNT Health Science Center to do long-term care and dementia care echoes. Similar to what the Alzheimer's Association was offering, it was a series, a limited series of these programs, but the topics came from, we polled people to say, what do you need to hear about? We know because we're doing the care every day as well, and we know what we need to hear and learn from. What experts do we need to get in here to talk to us, but what do you need? So I would say it was a very much outside of the case studies, we got here are the topics and here are the subject matter experts that we want to hear from. And that was a great pilot. We did it again in 2022, and it will continue to be a echo that we continue to do. We haven't done it. We didn't do one in 2023 because of personnel and bandwidth. But in 2024, we did want to also do a program around ethics in dementia care. Now, this echo was opened up to healthcare professionals, period. Whereas our long-term care and dementia one, we really targeted nursing homes and assisted livings for that particular echo. But the ethics and dementia care echo, it was healthcare professionals across the board, and we'll see the results here in just a second. But as we continue to do this, we know the benefit of echo. I'll talk about outcomes, but it has, yes, while it's one of the many programs that we offer here, it is one of the I guess probably well-rounded programs that we offer, because not only are you getting the lecture from subject matter experts and getting new information, but you also get the case studies and that validation of getting to work with people in the same industry as you, maybe in the same role, just at a different organization, but just being able to hear all the different perspectives in healthcare and how we can provide better care for people with dementia. And I know as looking through evaluations, our participants reported they appreciated the new information that was presented, but really, and Dana mentioned this earlier, being able to hear from other people and being able to hear those case studies. And it's the validation, like we also have this issue, so how can we work together to problem solve it? Our goals for 2025 and 26 is to repeat both the long-term care and dementia echo, obviously tweak them for relevant information, relevant topics, the ethics one as well. But we are going to go back to our original plan of doing an echo for focusing on family caregivers. So reaching family caregivers, but how do we work best with those families? It's a huge part of our mission that we do here at the West Center. So next slide. This is just some of the outcomes that we had from a long-term care and dementia echo that we did for a couple of years in a row. We did have they reported that the content was meaningful and relevant, provided practical suggestions that can be immediately applied in their organization, and that was our biggest pride point, I guess, is that the individuals walked away with ways that could change in their organization starting today or starting tomorrow. So they're going to incorporate this information into their community, not just, oh, that was nice to know, but here are some practical ways to start changing the way that we provide care for the better of our residents. So a lot of participants, 17 different communities, other universities. So we had our communities, whether it's assisted living, long-term care, nursing communities, area agencies on aging were largely represented. But we also had our educational institutions. So while we partnered with the educational institution, we also have relationships with other ones. So it is training those future healthcare professionals too, which I think is important, just as much as we're training those current ones too. So how do we get those people still in school, nursing school, therapy, to be a part of this ECHO, these many different ECHO programs? And you can see a list there of the different topics that we talked about for that A-session cohorts. And if you'll go to the next slide, and this is just information on our ethics echo that we did earlier this year. 95 reported that they would apply what was learned, an increase in knowledge, 80%, and that they would recommend the ethics echo. This one, we used a lot. It was a lot of heavy on the case studies with this echo, and it was very educational. We had 52 participants, 48 different organizations. Again, with these organizations, because it was open to anybody really. We had communities, long-term care communities, ombudsman's group, volunteer groups. We had insurance groups attend as well. So I thought it was interesting to see pulling out some of those other people that are in healthcare, but really on the peripheral, getting them involved in the echo. So, and then I wanted to say, I don't have a next slide, but I think one of the best things or some of the bigger outcomes that we really appreciate is that it has helped us as a small organization. We're just a one site organization with a small staff, but it has helped us to not only create and form, but really strengthen those larger relationships that we have, like with the University of North Texas and the hospitals here that are locally, the Alzheimer's Association. I attend their echo all the time and rely heavily on the information that they disseminate. So that's been very helpful. And then just being able to reach to these other organizations, whether it's other communities or insurance groups or whatever, not just reach them so they know about the James L. West Center, but really give them this information. Part of our mission is education. So they have this information that they can apply immediately to the work they're doing. And how Echo is set up really helps with that. And that's one of the best outcomes that our organization and our board members really find important and crucial. So, and I think that is it for mine. So back to you, Dana.
All right. Well, no, and I think that sets up really nicely. I think what we wanted to through this final step is share with you some of the steps that you could take to learn more about Project Echo, consider whether Project Echo is right for your organization, and how you can get involved. So we want to just share a few. I have a few last slides to talk about just that. And I will say I really appreciated Jamie some of the level setting and the examples. So as you all in this audience today think about what is your organization? Where are you coming from? How might you get involved? There's lots of ways that Project Echo can be utilized, both internally within an organization or externally to reach audiences in your community. So that's the kind of beauty of the model. And as Jamie alluded to too, just what we wanted to share was just this slide, which I felt would help with some level setting around the hub. So when Jamie talked about, her team of two, right, who's really sort of managing the Echo operations, that is really considered the Echo Hub. So the Echo Hub is the team that is managing and delivering Echo programs. So we just wanted to provide some of that nomenclature for you all today. But there are 3 steps to becoming an Echo Hub, and I think you're all here today, so you're sort of already in step 1, right? So learn all that you can about Project Echo. I think there's lots of ways that you can sort of follow up with both Jamie and I after today, right? So reach out to us if you want to talk about more about our programs. I would say join a program, join an Echo, whether it's locally in your community or look for one that is hosted nationally. There are Echoes, again, across numerous diseases and conditions and not just in dementia and older adult care, but find something that's of interest for you. There's no doubt something happening close by or within your state. So learn all that you can about Echo. If you do sort of move to that next step of wanting to develop your own Echo Hub, there is a formal agreement process that both James L. West and the Alzheimer's Association went through with the Echo Institute out of the University of New Mexico, where Echo is housed. And then finally, step 3 is train. So learning how to implement the Echo model within your organization and sort of with the audiences that you'd like to implement Echo with. The Alzheimer's Association in 2024 was designated as an Echo Super Hub. So what that means is we are now authorized to provide that formal training and mentorship to new organizations to successfully start and maintain those Echo programs. Our goal at the association is really to continue to grow that Dementia Echo network to address those gaps in dementia care. And again, as you are sort of thinking about how this might apply to you, again, there's lots of ways that Echo can be added to not just as you think about what would the infrastructure need to be in order to support an Echo program, but where can the benefits be for your community? as an Echo Super Hub, we've got lots of resources that we can help support you with along your Echo journey, not just in that training that I mentioned, but also in overall planning, program design, curricular guidance. We've got a lot of resources at the Alzheimer's Association around curricular materials, evaluation tools that really get at the heart of sort of evidence-based, best practice, person-centered dementia care. So we're happy to share what we can with you. So to not reinvent the wheel, that is another beauty of the Echo community is everyone is willing to help each other out. We also will provide some ongoing mentorship and quality assurance so that you can think about your program as a sustainable model. And then really one of the things that we love about the Echo community is the sense of community. So as Jamie alluded to, we get together, our dementia echoes get together and we share notes and we compare tidbits of challenges and our successes. And so really, how can we help facilitate those opportunities more? These are just some examples. We wanted to kind of share. We know there was going to be a wide range of organizations on the call today. So we came up with some examples, but I think again, this is where you can get the creative juices flowing. So these are just, typical organizations that might adopt the Echo model and how you could be using it. So I won't go through all of this today, but just stress that importance of Echo can really be adaptable and can be scaled at to the extent that you would like it to scale, right? And so there's lots of opportunities to think about, how you're going to use Echo. What is your target audience? So who do you want to support through your Echo program? What are the goals of that program? So are you trying to train workforce around early detection, or do you want to support family caregivers around the basics of Alzheimer's education and acceptance of the disease and the disease journey? There's lots of ways that Echo can be applied, and we wanted just to provide a few examples today. And I believe that is the last of the slides for our presentation. So Laura Ellen, I'm going to stop sharing my screen, and then I think we've got certainly plenty of time to answer some questions if there are coming in.
Yes, thank you. We did have a question from Natalie about evaluation tools, but it sounds like you might have just answered her question. But anything else that you want to share, either of you, on access to evaluation tools, how you can really use that to measure the impact? So this specifically is measure baseline knowledge and confidence of caregivers before and after participating.
Yeah, and I'll talk about what we do at the association. Then Jamie, I'll hand it over to you. We do, yeah. So exactly, we have pre and post measures. So pre-echo, where are you sitting in terms of some of those knowledge-based questions, as well as your sort of current level of confidence, and then we ask the same set of questions post-echo participation to see where we've moved the needle. The good news is that we continue to see that needle move positively in the way we want it to each and every time. I think the next step for us as an organization and really what we want to see is how do we create practice change, right? So how do we not just move, okay, you're feeling more empowered, but how can clinic teams and communities kind of take what they learn from Echo and apply it to something new within their practice? So I think but I will say that's where the kind of beauty of this Echo community that Jamie and I are both a part of is there's loads of resources across the Meta Echo community that you can tap into. And so we do a really good job of if I don't have the answer, but maybe Jamie does, I'm going to send you to Jamie, right? So we do a really good job of creating this little community within the work that we do.
Yeah, Dana mentioned the Echo community has so many resources for you to tap into in the medical. So you're not having to create anything or, just borrow and, ask for permission and bounce ideas off of your fellow Echo hubs or participants there. You're not having to create something. But they do make it pretty easy for you to set it up for each Echo that you do. So they have evaluations kind of already put in there for you, but you can create your own. So if you have a set of questions or certain demographics that you might need to do, you can incorporate that into their system. And everybody's part of an account. So it's easy for you to use and you're not having to do a lot of legwork for that. And I will mention this as far as funding, it is free to be an Echo Hub and go through all the training and everything. It would just be, I guess, internal funding for you to continue to provide the echoes within your organization. But Echo is so easy to be a part of because it's free. And I would really highly encourage you to go on to Echo today and sit in, sign up for one of the Echo programs, just to see what it's all about. And there's so many to choose from. Um, you could just sit there and learn all day long on Echo. But being able to see other people do it also is great.
Can either of you share that link, maybe Dana, like where people can go to view echoes that are happening and for people to join in to that? I don't know. I've shared a couple of links in the chat as you all were sharing. Hopefully that's helpful references. I'm not sure I captured that link, but that would be fantastic. So if you have any other questions for Dana and Jamie, please, you can put them in the chat if that's easier for you, or pop them in the Q&A. But I know for me, from AGE-u-cate, and really, I would say we're joining this webinar too to learn, to continue to learn as AGE-u-cate as we explore all of the programs that are out there and helping our program partners. That's one thing that we love to do, is help our program partners understand how to leverage all of the resources that are out there. And I know it's been so great over the last year or so to see so much more activity happen on a national level in terms of developing and providing access to resources. And then sometimes it becomes overwhelming when things are coming out so quickly. So I know this was incredibly helpful to us, and we hope it's helpful for those that were able to join us today. We hear a lot from our program partners with Dementia Live and Compassionate Touch. They're programs that are impactful and powerful. They really help spark advocacy and spark beginning conversations or beginning support or beginning understanding. And I think the connection in with Echo, whether you just join and learn, or you, like James L. West, really try to provide, through the Echo program, ongoing support. I think it's just a great tie-in. We always say that, Dementia Live is an essential piece of ongoing learning and training programs. And there's so many other pieces out there, right? So I really look at it as a puzzle. And what's so great about all the resources out there is really you can build your own puzzle. There's not a specific puzzle that you have to work with or a piece count that you have to figure out. So learning more about pieces that are out there and how you can put them together to form that puzzle that you want to display in the moment is fantastic. So again, it's just great to know that you're out there and that people can engage with it at your comfort level, right? So you can jump all in, or you can dip your toe in and kind of see what's right for your organization or your goals. Right. Anything else, Dana and Jamie? I know we've got a few more minutes. I don't see any other questions coming in right now, but anything else you'd like to leave parting words with our audience?
I encourage you to hop on to an Echo. I
Just
mean, I mentioned this earlier, but just go see what's out there, see what it's all about, join one, to really
yeah.
see, like Laura mentioned, if this is something your organization would be interested in or just participating in also.
We did have a question come in that said, do you want to answer that one, Dana? Is partnering with a university or faculty member a necessary component of being an Echo Hub?
Oh, that's a fabulous question. So I will say no. I mean, again, I think when you think about what, if you were to start your own and deliver your own Echo program, I think as you think about what are the goals that you hope your audience will learn, right? So it's about what are the gaps in our community? What are the needs that are being unmet right now in this particular area? Your subject matter experts might be the boots on the ground people who are doing it and who have developed the expertise, right? So I don't think so. I mean, say often, if you look at sort of the scope of echo hubs, particularly here in the US, many of them are housed at universities, but you're talking to people who aren't within university settings and who are echo who host echo programs. And so I think the way that you design your program, as long as you sort of have, you listen to your learners, right? You hear where their needs are, and then you identify the right people to deliver. I mean, I think one of the other things that's really important that Jamie and I could attest to is, the people who are leading goes are also really special people, right? They're people who are empathetic, who are knowledgeable, but who can help kind of facilitate learning in that sort of non-hierarchical fashion. So I would say it's just really about what the goals of your echo are, and then selecting the appropriate people to help that with you. Jamie, would you add anything to that?
No, I agree totally. We've had, I mean, we're lucky enough that we're able to partner with the university. But I mean, our subject matter experts are our direct caregivers, maybe our social worker, our nurses here. It is just echoing Dana, I 100% agree. It's what are your goals? What are your objectives? What do your learners want? And you get the appropriate people.
Thank you for sharing that. And then I'll just answer this for everybody or share. We will definitely share this webinar was recorded. We will share that out. So we typically send a follow-up email following our webinars that will include the recording to this webinar and information that we shared. It'll also include the information for CEUs. So if you came seeking CEUs as well as learning, then that information has already been shared in the chat as well. Let's see. We do have another question if y'all are good. I think we've got a
I
little
see it.
time.
Yep.
Okay. So it says,
Yeah, and
yeah.
yeah, I can read ongoing support from the Alzheimer's Association to Echo Hubs, for example, is there a way that the association continues to provide updates? Yes, really great question. I will say, again, not only in the sort of mentorship around, how to do Echo and how to kind of keep fidelity to the model. I think one of the really great benefits that I have here at the Alzheimer's Association is I have access to all of this really great resources, treatment updates, resources on research, what is the latest and greatest. And I will also add a plug that we do a really great job of connecting ECHO programs and learners to our local chapters, as well as our workforce that's sort of more boots on the ground, close to those individual clinicians and providers. And so, how do we kind of build this community of support around ECHO participants? As well as Echo Hubs that they'll have continued access to, again, sort of the latest and greatest, but also the support at the community level. So really great question.
Fantastic. Um, just a quick question. Do people need to sign in? So when you go to join in for maybe an active echo session, is it an account that you have to create to log in?
Yes. Yes, when you're looking at the sort of availability of public facing echoes on that iecho.org that Jamie dropped in the chat, they do kind of prompt you to create a login and kind of a profile, and then you can kind of get open access to what is available. Not all programs are going to be, I think, all open and public facing. Some programs will require some registration, but certainly kind of dig around and see where there might be a program contact if you can't directly get in, but you'll find support that you need there.
Fantastic. Okay. Well, again, Jamie and Dana, thank you so much for your time. I think our questions, we don't have any more. We've answered all of those. There were fantastic questions that came in. If you have questions lingering from this webinar, we'll be sure to share a way that you can ask those and get those answered by either Jamie or Dana. You can simply reply to our follow-up email that we're going to be sending out. So again, thank you everybody for your time. I hope everyone is well. Stay safe if weather is approaching you, and we'll see you next month, and we'll be sharing soon what our webinar topic will be. Take care.